Now moving up to the next, that is mycobacteria. Mycobacteria are acid fast rod, that is pink rod, here it is shown. And mycobacterium tuberculosis, that is TB, often resistant with multiple drug, that is mycobacterium avium, that is intracellular, that is causes diminished disseminated non-TB disease in AIDS, often resistant to multiple disease. Here M, that is mycobacterium scrofulicium, that is cervical lymphadenopathies in children. Now mycobacterium marium, that is hand infections in aquarium handlers. Now TB symptoms includes fever, night sweats, weight loss, cough, non-productive or productive, and hemoptysis. Cord factors creates a serpentine cord. Appearance in virulent, that is mycobacteria tuberculosis strains activates macrophage, then promoting granuloma formations and induces release of tumor necrosis factor alpha, sulfatides, surface glycolipids, inhibits phagolysosomal fusion. Now talking about tuberculosis, PPD positive if current infections or past exposure, PPD negative if no infections in immunocompromised patients, especially with low CD4 plus cell count. Now interferons gamma release assay, that is IGRA, that is interferon gamma released assay, that is IGRA, has fewer false positive from BCG vaccinations. Now caseating granuloma with central necrosis and Langerhans-Jandt cells, single examples in are characteristics of second degree tuberculosis. Do not confuse Langerhans-Jandt cells fused macrophage with Langerhans cells, the dermal APC, the antigen presenting cells. Here TB reactivations risk is highest in immunocompromised individuals. Examples: HIV organ transplant recipient, TNF alpha inhibitors use. Reactivations has a predilections for the apices of long due to bacteria being highly aerobic. Now talking about leprosy, last topic for today. Leprosy, that is also called Hansen's disease, caused by Mycobacterium leprae, an acid fast bacillus that likes cool temperature, infects skins and superficial nerves, globes and stocking, loss in sensations, and cannot be grown in vitro. Diagnosed through or via skin biopsy or tissue PCR, reservoirs in United States, that is armadillos. Now leprosy has two forms. Many cases falls temporarily between the two extremes. Lepromatous leprosy, that is presents diffusely over skin with leonine, that is lion like facies, and is communicable. High bacterial loads characterized by low cell mediated immunity in a largely T helper cell helper cells, that is two second type response, that is lepromatous form can be lethal. Now talking about tuberculoid leprosy, these are limited to a few hypoaesthetics, hairless skin plugs, plugs, okay, and characterized by high cell mediated immunity. Here in lepromatous leprosy, it is low cell mediated immunity is there, but in tuberculoid we can see high cell mediated immunity with a largely T T helper cells, that is first type response, and low bacterial load. In lepromatous type we see high bacterial load, and in tuberculoid types we can see T helper cells, that is 1. In lepromatous we see T helper 2.